We're doing an arthroplasty fifth toe, left foot.
Thank you.
That's good. If you want, there's a callus there. She gets pain in the shoes, and she comes into the office every few months, gets it like shaved down. What we're going to do is basically go in there, remove the callus, remove the bone, and this is the beginning of the procedure where we're just anesthetizing.
Okay.
So, ready for the block?
Yes.
Okay. So it's done under local anesthesia and a little bit of sedation. What we do is we make two semi-elliptical incisions and remove the center of it, kind of like the center of an eye. And then once we remove that skin, we can actually pull the toe up in this direction and straighten it out. And we're lifting that skin that's so thick. We're going to undermine the skin a little bit to allow the skin to be pulled over and derotate the toe. There's our joint, right there. And we can see this bone is pretty enlarged, and that's why she's having all the pain. Now we're going to kind of peel away the tendon like a banana. So we can see the tendon is healthy, it's in good shape. Okay, we want to preserve that. Now we're going to go down to below the joint and free up the bone. Actually, we're already ready for our bone cut. So we have our sagittal saw here, and it's important we basically stabilize the bone, make our bone cut. That's it. The bone is now cut. We need to free up the soft tissue from the inner aspect of the joint. We do that by using a blade. And there's our excess bone. That's removed. And we create a new space. That's called an arthroplasty. It can come out. There's our tendon, it's preserved. We have a new space there. When we close it up, she won't have that pain there. And what we're going to do is find our tendon and put a couple sutures in there. Reattach it to where it was attached.
Yes. If they're having research, is that good? Well,
because the skin is under a lot of pressure, we actually don't get much of a scar. It's just a little injectable to prevent inflammation after the procedure, prevent swelling. So it helps prevent pain. So the procedure just takes about 10-15 minutes. Not a long procedure by any means.
And what is the healing time after the surgery?
She'll come back to the office in about 5-6 days. We'll just take a look at it. We'll make sure everything's healing okay. In about 10 to 12 days, we'll remove the stitches. She's back into a shoe in about 3 weeks.